Hello, this is Chambesino Pharmacosis YouTube channel where we make your life easier with the subject of pharmacology. So in the previous session, it was session number 4 where we have already covered on the distribution of the drug. So today this is session number 5 where we are going to discuss on the drug metabolisms. So before we proceed, I would like to remind you to subscribe our YouTube channel and turn on the notification so that you will be updated when new content is uploaded in our YouTube channel. So for the session of today, which is the metabolisms, as you can see from the slide here, it shows those 4 pharmacokinetic parameters, which is the absorption, distribution, metabolism, and excretion. So once you take the drug via the oral route, for example, it might be the tablet or it might be the capsule or in solution form. So first it will undergo the absorption, meaning that from the site of administration into the systemic circulation or the plasma. So once it reaches into the systemic circulation, it will undergo the distribution where it will be distributed into the different sites, including the site of action and in the other tissue. So some of the site of action where the drug it will be distributed, it will be the site, the tissue that involved with the metabolism of the drug, including the liver. So for the drug to be excreted in this case, some of the drug, especially if it is lipophilic, first it has to undergo the biotransformation so that it can be converted from the lipophilic to hydrophilic, then it will be easily excreted through the renal system, which is the kidney. So for the session of today, which is the metabolism, we are going to see in detail how this process of the biotransformation is taking place for the case of the drug in the body. Yes, again, this is the description or the diagram that shows those 4 pharmacokinetic parameters. If you take the drug in the solid dosage form via the oral route, it will undergo disintegration and dissolution via in the stomach to release the drug, which is in the form of the solution. So the solution form of the drug, it will undergo the first pharmacokinetic parameter, which is the absorption, means into the systemic circulation. So once it reaches into the systemic circulation, some amount of the drug, it will be in the free form, while another it will be in the bound form. So it will establish the equilibrium between the free form of the drug and the bound form of the drug. It is the free form of the drug that will be able to undergo the metabolism and be excreted through the excretory organ. So whenever you talk about the biotransformation as the topic for today, we have to forget all those drugs which are hydrophilic, because most of the hydrophilic drugs, they are not undergoing the biotransformation. It is excreted through the kidney in an unchanged form. So biotransformation is not taking place for the drug which is hydrophilic. It is only the lipophilic drug that we are going to see today for the process of the biotransformation. So by definition, what is biotransformation? It involves the chemical alteration of the drug in the body. It means the drug which is lipophilic, it is chemically altered into the hydrophilic so that it can be excreted. So this chemical alteration is taking place within the body. So this biotransformation, it occurs so that to prevent the drug from the renal reabsorption, because if the drug it is lipophilic, it will not be excreted through the kidney, rather it will undergo the renal reabsorption and it can precipitate to the toxicity because this drug it will not be eliminated from the body. So if you consider this diagram here, it indicates that if you take the drug via the oral route, so it will pass through the esophagus, reach into the stomach. For the acidic drug, it will get absorbed from the stomach into the systemic circulation. But if it is the basic drug, it will get absorbed into the small intestine and reach into the systemic circulation. From there, systemic circulation, the free form of the drug, it will get distributed and reach into the site of action where it will induce the pharmacological effect. But once it provides the pharmacological effect, this drug has to be eliminated from the body. So it will go back into the systemic circulation, then it will be eliminated from the systemic circulation via the organ which is responsible for the excretion. So in this case, it is the kidney will excrete the drug. But it will not be possible for the drug to be excreted for the fact that the drug it is lipophilic. So first it has to go into the organ which is responsible for the metabolism, which is liver in this case, whereby the liver it will convert the lipophilic drug into the hydrophilic drug. Then the drug it will be eliminated once it will be converted into the hydrophilic drug, whereby the kidney it will be the primary site for the excretion of this drug. So for this case, the whole process, it will be explained in this brief diagram. So this diagram, it is just for the sake of understanding. So we can proceed from here. So as we have seen here, the biotransformation, it is only for the lipophilic drug. Most of the hydrophilic drug, especially like streptomycin, mean like those aminoglycoside, neostigmine, this drug has a tendency to undergo a biotransformation, means little biotransformation, and in most cases, this drug, it is excreted in unchanged. As you have seen, the process of the metabolism, there is a primary site which is responsible for the metabolism of the drug, which is liver. So whenever the metabolism that is taking place apart from the liver, this is considered as the extrahepatic metabolism, means it takes place in the other organ apart from the liver. So some of the drug, it will be metabolized in the kidney, for example, the vitamin D. Some of the drug metabolized in the GIT, for example, the penicillin and the insulin. We have some of the drug can be metabolized in the lung, for example, the those serotonergic drug. Some of the drug that are metabolized in the plasma. Here we include those drugs, including the succinylcholine via the pseudocholinesterase enzymes. And some of the drug can be metabolized through the skin. For example, here as an example is the 7-hydroxycholesterol, which is converted into the cholecalciferol, which is vitamin D, and then it will be excreted. So these are just some organ which is responsible for the metabolism of the drug, where we have seen some of the drug is metabolized in the kidney. Here we talk about the vitamin D, and some of the drug like serotonergic drug is metabolized in the lungs, whereby the primary site for the metabolism, as we said, that is the liver. So once the drug, it will undergo the biotransformation, it means from the parent drug into the metabolite. So the metabolite that will be obtained, it might be active or it might be inactive. So the following, it will occur once the biotransformation it happened. So the active drug, it will be converted into inactive, or the active drug may be converted into the active metabolite, or some of the drug which is inactive after metabolism, it will convert into the active metabolite. So we're going to see all this happening that occur after the biotransformation. But the most important here, it is the inactive drug, which is considered as the prodrug, which is converted into the active after undergoing the metabolism. So at least you have to understand some few examples in each process that occur, whether the drug it is converted into the active or into the inactive form. So for this case, let's start with the active drug that will be converted into inactive drug. This is very common for the majority of the drug. Once it undergoes the biotransformation, it will change from the active form into inactive form. So most of the drug and the active metabolite, of course, they are inactivated or they become less active, and then it will be causing the pharmacological effect, because now it is in a polar form, then it can be excreted via the kidney. So some of this example of the drug include the ibuprofen, paracetamol, this is the non-steroid and anti-inflammatory drug, lidocaine as a local anesthetic, chloramphenicol as the broad-spectrum antibiotic, and the propranolol as the beta-adrenergic blocker, which is non-selective. So this diagram, by explaining those drugs which are active and converted into inactive form, you can see, as we said, the drug, once it reaches into the systemic circulation, first it has, because the drug it is active, means it will be distributed into the site of action. So if it reaches the site of action, because it is active, it will induce the pharmacological effect. So once it causes the pharmacological effect, the drug has to be eliminated. Then it will go back into the systemic circulation. Then from the systemic circulation, it will be eliminated. But for this case, we say that elimination, it will not be possible for the lipophilic drug. Then it has to be converted into the hydrophilic drug in the liver. Then the drug that will be metabolized from the liver, which is now the metabolite, and this metabolite, it will be inactive in this case. The drug which was active, it is converted into inactive. So this inactive, it is inactive metabolite. So this inactive metabolite is polar, then it will be excreted via the kidney, and it will not be able to cause the pharmacological effect, because in this case, the metabolite, it is inactive. So it will not cause those pharmacological effect. So this is all about the first phenomena, where we can see the active drug, it is converted into the inactive form. So we can proceed from here. Let me remove this mark. So what is showing here, it is all about, well, let me remove this mark. Yeah, from there, after the active drug, once it is converted into the inactive form, we have another method where the active drug will be converted into the active metabolite. It means the drug, it was active, so once it will be biotransformed, then it will be still inactive form. So this is very few drugs with these properties, including those drugs like diazepam and amitriptyline. So it is active even the metabolite after undergoing the biotransformation, it will be inactive form. So the same applied, it will get distributed into the site of action because it is the active drug. For the drug to be eliminated, for this case, it has to go back into the systemic circulation and then executed through the kidney. Because it is the lipophilic, then it has to go through the liver where it will be biotransformed. And the metabolite that will be obtained in this case, it will be the active metabolite. So the metabolite, it can cause, again, the action, it can reach to the site of action to cause pharmacological effect. Also, because it is polar, it can be eliminated via the kidney. The important here, we said it is the inactive drug which is converted into the active drug. Some of the drug, it is inactive. It is prepared in the form, in a dosage form, which is in active form. It will be active only when it undergoes the biotransformation. So once it will undergo the conversion in the body, then it will form the active metabolite. For example, this drug, it is considered as the pro-drug, and it is made in this form for the fact of increasing the bioavailability and reducing the side effect that might occur, because it will provide action, it will be active only once it reach into the body after making the biotransformation. So for this case, the drug, once it get absorbed into the systemic circulation, then because it is inactive drug, it will not go to the site of action, it will go directly into the liver where it will be transformed, biotransformed and form the active metabolite. So the active metabolite that we obtain from the liver, it is the active metabolite and the polar. Then it will act into the site of action to induce the pharmacological effect. Also, because it is the polar form, it will be excreted via the kidney. So that is all about this. So it is very important to know some example for this pro-drug, which is inactive and converted into the active form. So there is a special mnemonics that we can use to memorize all these drugs. So these mnemonics you can use, we call it all prefer doing MD in clinical subject. What is all means? It means all angiotensin converting enzyme inhibitor except captopril and lisinopril. So all those, for example, including those angiotensin converting enzyme with the exception of the captopril and the lisinopril. While P, from the word prefer, it includes here the prednisones, proton pump inhibitor, and the proguanil. And doing means the dipivefrin. This is the pro-drug. This is the pro-drug of the epinephrine. So this the epinephrine, it is used for the treatment of the open-angle glaucoma. Also, the M, it stands for the three drug, which is mecapropurine, methyl-dopa, minoxidil. And doing this, it stands for the levodopa. While in, this means irinoticans, and the clinical, it stands for three drug, which is the cyclophosphamide, clopidogrel, carbimazole, and S subject stand for sulfasalazine. So these are just a few examples and the way that you can memorize. All prefer doing MD in clinical subject. So you can use these mnemonics to memorize all total pro drugs. So from this fact, by the fact of memorizing, you can use these mnemonics. So for example, these are some of the question that you can meet. For example, this, which drug is the pro-drug? For example, neostigmine, enalapril, captopril, and esmol. So from this question, the answer means the pro-drug, it will be enalapril. So enalapril and captopril, the angiotensin converting enzyme, but with captopril, it is part of the exception of the pro-drug. So the answer is B. Also, which drug is the pro-drug? For example, A is ampicillin, captopril, levodopa, and phentoin. So the pro-drug here, it is levodopa. The answer is C. So you use the same mnemonics. So after understanding the result that occur after the drug undergo the biotransformation, now let's see the classification of the biotransformation. So there are two phases for the biotransformation, phase 1 and the phase 2 phase of the biotransformation or metabolism. Phase 1 is called non-synthetics or functionalization reaction, and phase 2 is called the synthetic or conjugation reaction. So we're going to see why it's called functionalization, why it is called the conjugation. So first understand these two phases. Phase 1, the non-polar drug, which is lipophilic as usual, it is converted into the polar, and it involves the parent drug get exposed into the particular function group, which is polar. So this function group, it includes introduction of the function group, which is polar, like the hydroxy group, the amine group, the thionide group. So this group, it will make the parent drug to be polar. So once it will be polar, then it will be excreted. So the resulting metabolite here, it might be the active or inactive. So for this case, there are different reactions that is considered as the phase 1 reaction. There are almost 5, which is oxidation, reduction, hydrolysis, cyclization, and decyclization. So we're going to see in detail one by one. So in case of the phase 2, it involves conjugating with the parent drug with the polar endogenous substance to make the drug extreme polar, so that it can be eliminated through the kidney or through the bile. It depends with the type of the phase 2 reaction. So this endogenous substance, which is polar, it includes like the glucuronide, which is the derivative of the glucose. It includes those glutathione, the sulfuric acid, the glycine. So this we are going to see those reactions which is included in the phase 2 reaction. So we do conjugation to the drug in the phase 2 to increase the drug hydrophilicity. So some of the drug that undergo, majority of the drug which undergo the phase 2 reaction, they ultimately become inactive. With the exception of some of the drug, for example, the morphine has to undergo the glucuronide conjugation, and it become extreme active in comparison with the parent drug. So majority of them, once it undergo the phase 2 reaction, the drug it become inactive. But in this case, there are few exceptions. For example, the morphine, whereby the metabolite it will become active. So what are those reaction which is included in the phase 2? So there are 6 reactions that included in the phase 2 reaction, which is glucuronide conjugation, glycine conjugation, glutathione conjugation, the sulfate conjugation, methylation, and the acetylation. So here you can say we have 3G SMA. This is the mnemonics that you can use. 3G SMA. So the first 3G, this is for the those drugs, which is glucuronide, glycine, glutathione. S is the sulfate conjugation, M is the methylation, and A this for the acetylation. So briefly description for these two, phase 1 and phase 2 here. So forgot about those word microsomal and non-microsomal. Here I'm going to tell you in detail what is microsomal and non-microsomal. So what I'm telling you here, just focus to the reaction, which are the reaction is occur in phase 1 and which are the reaction that occur in phase 2. So for those reactions that occur in phase 1, it includes those oxidation, reduction, hydrolysis, cyclization, and decyclization. So for the oxidation here, it might be the hydroxylation, dealkylation, oxidative diamination. Those are the oxidative reaction that occur in phase 1. But for the phase 2, here we have 6 reactions that we said it is the glucuronide conjugation, which is the glycine conjugation, glutathione conjugation, methylation, and acetylation. Also, there is sulfonation. So as you can see here, if the drug is undergoing phase 1 reaction, it means the metabolite, it will contain some polar group or function group which is introduced for this, the parent drug. So the metabolite will have function group which is polar to make the drug polar. So phase 2, it might be the continuation of the phase 1 metabolite, or the drug, parent drug, to undergo phase 2 direct if it contains the polar function group that can favor the drug to be conjugated with the endogenous polar compound. So for example, this is the product or metabolite from phase 1, where it will get conjugated with endogenous polar substance to form this huge molecule which is extreme polar, so that it will be excreted. In most cases, it is excreted through the bile, or if it is in small size, it will be excreted through the renal system. But this is not the case for the phase 2 to occur only from phase 1, but the drug, it can undergo direct, means the parent drug, it can undergo direct phase 2 and get the metabolite which is in conjugation with the polar endogenous substance, and then it will be ready to be excreted through the excretory organ, including the bile and the kidney. So phase 1 reaction in detail now, as we have seen those 5 reactions from the phase 1 reaction, which is oxidation, reduction, hydrolysis, cyclization, and decyclization. So starting with the oxidation, it involves the addition of oxygen or removal of the hydrogen. So in most cases, this oxidation, it is carried out with the microsomal enzyme. So as I said, we are going to discuss in detail what is microsomal enzyme, but for this time, we just understand the process of oxidation. It is carried by the microsomal enzymes, and this microsomal enzyme will involve the cytochrome P450, the flavin containing monooxygenase, and this epoxide hydroxylase. Among of this enzyme, we are going to discuss in detail about the CYP450 microsomal enzyme. So this 450 CYP450 microsomal enzymes, it metabolizes almost 2/3 of the drug. It is metabolized by these cytochromal enzymes. So as you know, these cytochromal enzymes, they are about 200. There are more than 200 CYP400 isoenzymes, which is grouped into the family of about more than 20 families. So they are called CYP450. So this 450, it is obtained from the fact that this isoenzymes has a tendency to give the maximum light absorption with the pink color at the wavelength of 450 nanometer when it is treated with the carbon monoxide. That's why its name is called the cytochrome P450, because of this kind of the wavelengths. Among of all these, the name of these enzymes, of course, it has some meaning. So I will let you know. Consider this one of the cytochrome enzyme is called CYP3A4. This is the most cytochrome enzyme that involved in the metabolism of majority of the drug. So from this name, the first number, this it indicates the family. So it belongs to the family number 3. The second is the letter. So this letter, it indicates the subfamily, so belongs to the subfamily A. And the second number, which is the third in the series, this it indicates the gene. So this it indicates gene number 4. So it is very important to know what are the implications of this name. So as you can see here, we said this is a family. So there are more than 20 families. So among of those more than 20 families, it is only family number 1, family number 2, and family number 3 that involve in the metabolism of most of the xenobiotic compound in the bodies. So it is very important to know what is the implication of this number and the letter in the name of this enzyme as a microsomal enzymes. So as you can see here, we said the a number that denoting the family, that is the first number, and the letter, it denotes the subfamily, and another number, it denotes the gene numbers. For example, as I've shown this type of one of the cytochrome enzyme, which is CYP3A4. This belongs to the family number 3, subfamily A, and the gene number 4. This it will be applied also for the CYP2D6, also for the CYP2C9, the same applied. This and we say like among of those more than 20 family, it is only the cytochrome 1 to 4 that involve the metabolism of the xenobiotic in the human. So by understanding that, we have to know which are the cytochrome enzymes that involve in metabolism of majority of the drug. As I said, it's subfamily 1 up to the 3. So mostly about 55% of the drug, it is metabolized by the cytochrome 3, 4A isoenzymes. Also about 30% is metabolized by the cytochrome 2D6, and about 10% is metabolized by the cytochrome 269, and 2% is metabolizing 2% of the drug is metabolized by CYP1A2 enzyme, and 3% is metabolized by the other isoenzymes in the cytochrome P450 enzymes. And this metabolism takes place in the liver. Also, it can take place in the small intestine. So as you can see, because this is the microsomal enzymes involved in this metabolism, so this enzyme, it can be induced. There is a special fast substrate that is responsible to be metabolized by these enzymes. As you can see here, this is the list of the substrate, and this enzyme, it can be induced or it can be inhibited. So there is some special drug that can be responsible to induce this process or to facilitate this substrate to be metabolized by activating the enzyme or increasing the synthesis of the microsomal enzymes. Also, there is another drug or substance which is responsible to inhibit this process by inhibiting the metabolism of the drug. So it is very important here to understand, because we are going to discuss in detail, you will have to know which are the substrate for these isoenzymes, which are the inhibitor, and which are the inducer for this. So there is a special mnemonics that you are going to use to make the memorization for all these, the substrate, inducer, and inhibitors. So this is all about the cytochrome 450 enzyme in the process of oxidation. And we say that the oxidation also, it can be by the flavin-containing monooxygenase. There are about 6 flavin-containing monooxygenase. It is only the flavin-containing monooxygenase 3 which is involved in metabolism, and it is present in abundance in the liver. So for this case, it is different from the cytochrome, which is the CYP450, because these are not induced and they are not inhibited. So there is no drug interaction. And the drug that can be metabolized by this enzyme in the process of oxidation, including the nicotine, the histamine blocker, the clozapine, and etopride. These are just a few drugs that can be metabolized by these flavin-containing monooxygenase enzymes at the part of oxidation. In the part of oxidation also, we have seen the epoxide hydroxylase. What I want to say here is when the metabolism that occur in the CYP450, it will form one of the intermediate. For example, in those aromatic oxidation, it will form one of the intermediate, which is an epoxide. So that epoxide, it is very toxic, and it has to be converted into the less toxic. So for this, we have to the special enzyme, which is epoxide hydroxylase, that convert this epoxide containing compound and deactivate them, form those compounds that contain hydroxide, which is less active, so it will be deactivated. The good example here is they call it the carbamazepine, which is formed the epoxide after CYP metabolism oxidation. Then that metabolite is highly reactive. Then the epoxide hydroxylase, it has a tendency to deactivate by removing those epoxide-containing compound in this carbamazepine and form the inactive form, deactivated compound. Then we have seen this all of oxidation. Then you can see for the part of the reduction. Reduction means addition of hydrogen or removal of the oxygen. The same reaction that occurs in the oxidation. So the part of the reduction, it involves the use of CYP450. But it will be in the opposite direction with the oxidation. So some of the drug, including the chloramphenicol, the halothane, warfarin, and the chlorohydrate, these are some of the drug that can undergo the process of reduction. Also, we have the drug like levodopa, which undergo the dopa decarboxylation to form the dopamine. So these are the example of the reduction process. And another is the hydrolysis. This it involves breaking down of the compound with the help of the water molecule. So most of the compounds that can be hydrolyzed with the water molecule, including those that contain the ester compound, where it will be hydrolyzed under the presence of esterase enzyme to form the acid and alcohol. But those compounds that contain the amide also, it can be broken down with the help of the water molecule. This compound, including like the procaines, which is get hydrolyzed, here I mean the procainamide and the lignocaine. These are containing the amide, a special enzyme for the process of hydrolysis for the amide containing compound, it is the amidase enzymes. While for the ester containing compound, it will be hydrolyzing with the help of the enzyme that is called the esterase enzyme. So it is very important to know the example for the case of the hydrolysis also. As I said, that we have the lignocaine, procainamide, and lignocaine. These are some examples. Another part of the phase 1 reaction, we said it is cyclization. So from the word itself, something that was in linear chain, then it is converted into the cyclic form. So the parent drug, it will be in form of the linear, then it will be undergo the chemical alteration in the body, and then it is converted into the cyclic compound. So for example, one of the drug which is in form of the prototypes is called the pro drug, for example, the proguanil, which is converted into the cycloguanil. So cycloguanil, it is in form of the ring form, while the proguanil, it has a linear chain. Apart from that, we have the decyclization, which is the opposite of the cyclization. So here, decyclization, it involves opening of the ring form of the drug. So those drug which was in form of the cyclic form as the parent drug, once it will undergo the metabolism, it will form the linear chain. But this is very minor pathway in the process of the metabolism. And here we include the drug like the barbiturate and the phentoin drug, which is in form of the cyclic. After metabolism, they form the metabolite, which is the linear chain. So that is all about those metabolic reaction, which is phase 1 and the phase 2 reaction that we have already covered. Now let's see a detailed information among of phase 1 and in this phase 2. As we said that this involves conjugation of the parent drug with the endogenous polar compound to form the drug which is highly polar, which can be excreted through the urine or bile. And this process of the phase 2 reaction, it requires energy, so it is energy dependent. And we have seen those phase 2 reaction, which is the glucuronide glycine conjugation, glutathione, sulfate conjugation, methylation, and acetylation. So this here, it indicates all the phase 2 reaction, and here we have to know which kind of the drug or the parent drug, which properties the parent drug should have so that they have to undergo a particular phase 2 reaction. So here we are going to see it, the example for endogenous substance which complex with the parent drug, and which are the drugs that are undergoing this process of the phase 2 reaction, and what are the clinical significance for this process. So we are going to see it in detail one by one. So starting with the glucuronide conjugation, as we said that it involves conjugating the parent drug with the glucuronide as endogenous substance, which is the derivative of the glucose, under the presence of the enzyme that is UDP glucuronosyl transferase enzymes. So some of the drugs that can undergo this process, it include those chloramphenicol, aspirin, paracetamol, morphine, and metronidazole. So what I want to say from this, for the drug to undergo the glucuronide conjugation, it might be the metabolite from phase 1 reaction, or it can be the parent drug which have never undergone phase 1 reaction. So it will go direct to undergo the phase 2 reaction. But this process of the glucuronidation, it is not only for the xenobiotic means that the drug, but it is also some of endogenous substance has a tendency to get conjugated with the polar endogenous substance and form the highly polar compound which can be excreted. These substances, including the bilirubin and the thyroxine, they can utilize the same pathway for it to be excreted. So what you can see here, this is the process that occurs, means glucuronidation, it involves the increase the molecular size of the drug so that it can be excreted through the bile. So here the drug glucuronide excreted in the bile because it is a very huge molecule which cannot be excreted through the kidney because of the size. So most it will be excreted through the bile. But once it is excreted through the bile, it will go through the duodenum into the intestine, where there is a bacteria which cause the deconjugation, means metabolizing this drug and the glucuronide. So the glucuronide, it will be separated from the drug. Then the drug which is liberated, it will be able to be reabsorbed again via the portal vein and reach into the liver. So it will be circulating on the same pathway from the intestinal to the liver, from the liver into the intestinal. So this pathway is called the enterohepatic recycling system of the drug. So by doing so, this it will prolong the duration of action of the drug, because the drug will not be excreted direct, it will be circulating from the intestine to the liver, intestine to the liver, then from the liver it will be absorbed some amount to provide action. So this is the passage, and it will increase the duration of action, and it is very important, especially for the drug like oral contraceptive, the drug like digoxin. They have a long duration of action because of the behavior of undergoing this intrahepatic recycling system, and for the fact that it is undergoing the phase 2 reaction, which is the glucuronidation. So you can see from this here, it indicates that once you take the drug, it will reach into the intestinal tract. From there, it will be absorbed via the hepatic vein, the portal vein, and reach into the liver. From the liver here, it will undergo the phase 2 reaction, which is the glucuronidation, and it will form the drug glucuronide conjugate molecule. This molecule, again, it will be excreted via the bile into the duodenum and reach into the GIT. From there, it will be metabolized by the bacteria which is present into the GIT, whereby the glucuronide molecule, it will be eliminated via the GIT, while the drug, it will get absorbed again. So that circulation, it results to the increase the action of the drug. So the same diagram that indicates the intrahepatic recycling system for the drug that undergoing the phase 2 metabolism. Here, it is the GIT. Once you take the drug, from this, the drug, it will get absorbed and reach into the liver via the portal vein. From the portal vein, it will undergo the intrahepatic, the glucuronide conjugation, phase 2 reaction. From this, it will form the complex molecule to the extent that it will not be excreted via the kidney. Instead, it will be excreted via the bile and discharged into the small intestine, where it will be metabolized or degraded or decomposed by the bacteria in the gut, where the glucuronide molecule will be excreted through feces, whereby the drug, it will undergo the same fate of absorption and repeating the circulation to prolong the duration of action. Same diagram indicating the intrahepatic recycling system. So this is the first reaction, which is the glucuronide conjugation. The number 2 reaction, it is the acetylation. So this acetylation, it occurs especially for the drug that contains the amide or the hydrazine molecules. So including the drug like isoniazid, hydrazine, sulfonamide, procainamide. So this process of acetylation, it involves the N-acetyl transferase enzymes. This enzyme, it is linked with the gene, so it shows the genetic variation. Depending on the availability of the genes, which is responsible to alter this process of acetylation, some of individuals, they have abnormality with these enzymes, or the deficiency or damaged enzymes. So this individual, they are considered as the slow acetylator, while some of them, they have larger quantity of this enzyme, this fast acetylator. So understanding whether it is the fast acetylator or it is the slow acetylator, it is very important for you as a doctor or as a pharmacist to give the drug to the patient, because if it is the slow acetylator, it results to the it can precipitate to the toxicity if you give the normal dose as in the normal individuals. So if it is the fast acetylator, this can result to the therapeutic failure, because the enzyme will be in large quantity, which can lead to the drug to be excreted before providing the pharmacological effect to the patient. So the therapeutic failure will occur. Some of the drugs, as I've already mentioned, including the isoniazid, first-line anti-tubercular drug, the dapsone, sulfonamide, hydralazine, clonazepam, and procainamide. These are some of examples of the drugs that can undergo the process of the acetylation. So here, for example, the isoniazid, where it will undergo the N-acetyl transferase 2, in the process of N-acetyl transferase 2 enzyme, where the acetylation will take place to form the acetyl isoniazide, which will be hydrolyzed to give the metabolite, which is polar, and then it will be excreted after undergoing further metabolic process to prevent the hepatotoxicity. So this is all about the methylation, the acetylation. And the next phase 2 reaction, it is methylation, means addition of the methyl group to the parent drug to form the metabolite that contain the methyl group, but it must be the polar. So enzyme, which is the methyl transferase, is very important for this process, and it is special, especially for those drugs like catecholamine, including the adrenaline, also for the drug like histamine, nicotine, methyl dopa, captopril, and captopril. These are some of the drugs that have the tendency to be added with the methyl group as the process of the metabolism within the body to form the polar compound that can be excreted. So another reaction apart from this, it is the sulfate conjugation. This it involves addition of the sulfate group to form the polar compound, and it is very special for the drug which is phenolic or the steroid. So it includes those drugs like the chloramphenicol, those adrenals, those drugs which is steroid in nature, including methyl dopa, adrenal, and the sexy steroid. So this drug to be added with the sulfate conjugation and form the metabolite. In most cases, this metabolite, they are reactive metabolite, so they are not active metabolite. So for this case, we require the enzyme which is the sulfotransferase enzymes for the process. So most of the enzymes in this phase 2 reaction, they are transferase in nature, whether to transfer the sulfate group. Another phase 2 reaction is the glycine conjugation. So in the glycine conjugation, it involves the parent metabolite get conjugated with the parent drug to form the metabolite, which the drug which can be undergo this process of the glycine conjugation, it is especially those drugs that contain the carboxylic acid. So this including the salicylic acid or the aspirin drug. So this amount, the glycine as an endogenous substance in the body, it is very limited. So because of the limitation amount of the glycine, if you take the large quantity of the drug which can be metabolized by the glycine conjugation, it means it will have a tendency to undergo the zero kinetic order of elimination, because all amount of the glycine will be conjugated with the parent drug to form the parent metabolite, which is polar and will be excreted. Then upon keep on taking the drug, the glycine it will not be there. So the rate of elimination of the drug, it will not be direct proportion with the plasma concentration of the, so it can precipitate to the toxicity because of this zero order kinetics. And another reaction, as we have seen here, for example, salicylic acid and the nicotinic acid, these are the drug that can undergo the glycine conjugation. And another type of the reaction that occurs in phase 2, this is the glutathione conjugation. So this it is taken or carried out with the glutathione S transferase, forming the mecaptolate. But this is very minor, and it is very important for maintaining the integrity of the red blood cell. So glutathione, as it is important to maintain the integrity. So for this case, if you take the drug has a tendency to complex with this glutathione, form the polar compound which can be excreted. So the toxicity that occur for the drug like paracetamol, which is metabolized by this process of the glutathione conjugation, it will conjugate with the glutathione, which can lead to the depletion of the glutathione in the body, which is, this glutathione is important. So by depleting the level of the glutathione, it can lead to the drug which is not conjugated with the glutathione to cause the toxicity. For example, the paracetamol toxicity, which can lead to the hepatotoxicity. This is due to the depletion of the glutathione, because the paracetamol, which is taken in large dose, some of amount, it will deplete the level of the glutathione by conjugating with it and get excreted. So this it can lead to the hepatotoxicity. So it is very important to understand all this pathway. So from this here, what we have to proceed here is the microsomal enzymes. So in this passage, we have seen those phase 1, phase 2 reaction, and those reactions that occur in phase 1 and phase 2, and what are the drugs that are undergoing a specific biotransformation in either phase 1 or phase 2. But we have seen the enzyme which is involved in this process of the metabolism. So there are two enzymes that involved in the process of metabolism, which is is called the microsomal enzyme, and some of the enzyme is considered as the non-microsomal enzyme. So here we are going to see what is microsomal enzyme and what is a non-microsomal enzyme, and which enzyme are involved in which type of the metabolic reaction, whether in phase 1 and phase 2 reaction. So what you can see here, starting with the microsomal enzymes, this microsomal enzyme, it is present inside of the liver, particularly inside of the liver in the hepatocyte, specifically into the endoplasmic reticulum. So this endoplasmic reticulum, it will contain special enzyme that called microsomal enzyme, which is responsible for the metabolism of the drug. But when we say the non-microsomal enzyme, it is present in the hepatocyte, but it is not in the endoplasmic reticulum, but it is present either in the cytoplasm or into the mitochondria in the liver. So as you can see, microsomal enzyme, it is present into the endoplasmic reticulum, and it participates on those phase 1 reaction, including the oxidation, reduction, hydrolysis, with the exception of the cyclization and the decyclization. So in phase 1 reaction, it involves both microsomal and non-microsomal enzyme. For the first 3 reaction, it is microsomal enzyme, which is oxidation, reduction, and hydrolysis. But for the last 2 reaction, it undergoes non-microsomal enzyme, which is cyclization and decyclization. So these enzymes can be induced. It means it can be if you take some of other drugs, they have a tendency to increase the activity of this enzyme. So we call it the enzyme induction. Also, it can be inhibited. So for this case, it can lead to the drug interaction. So from this diagram here, what is showing for the process of metabolism to take place in the liver. So if you see this liver here, what is indicating here, this indicates this is the nuclear in the hepatocyte, while the round diagram here, it indicates those hepatocytes, whereby inside here, it indicates the endoplasmic reticulum. The red dot, this it indicates the drug that has to be metabolized with the purple color here. This is the microsomal enzymes. So the drug, if this drug has to be metabolized by the microsomal enzymes, if you take another drug, so another drug, it might has a tendency to induce the microsomal enzyme to increase the metabolism, or it can inhibit the process of the microsomal enzyme metabolizing the drug. So it depending on the nature of the drug, that whether it is the enzyme microsomal enzyme inducer or it is the microsomal enzyme inhibitors. So we're going to see it in detail. So the same applied here. The A, it indicates the drug which is metabolized by the microsomal enzyme, which is represented by the purple color here. So this here, it indicates the endoplasmic reticulum, which is present inside of the hepatocyte in the liver. So this drug, A, once it will be taken, it can be inhibited by another substance B, which can either causing induction or the inhibition. So in this case, you can see, for example, here we have this considered as the microsomal enzyme. It has active site and non-active site, which is considered as the allosteric site. So the substrate which is responsible to be metabolized, it can be, it is acting direct to the active site. But there is another substance here considered the substance B, which can compete to the active site. This is called the competitive inhibitor and prevent the inhibition of the drug A. But it can bind to the allosteric site and induce the conformation change of the enzyme, which can prevent the drug A to bind to the active site. So that is the way how the inhibition it can occur for this case. So as you can see in phase 1 reaction, we say that both microsomal and non-microsomal enzyme it is occur, but it is only for oxidation, reduction, and hydrolysis where the process microsomal enzyme is induced. While the rest, which is cyclization and decyclization, this is the non-microsomal enzymes. So that is all about the microsomal enzymes. While the non-microsomal enzyme, we said it is present into the hepatocyte, but in the cytoplasm or into the mitochondria of hepatocyte. So here it involves catalyzing those oxidation reduction, some of hydrolytic reaction, and those are phase 2 reaction with the exception of the glucuronide conjugation. So in phase 2 reaction, it is only the glucuronide conjugation that undergo the microsomal enzymes catalyzation, while those remaining, including the glutathione, the glycine, methylation, acetylation, those has a tendency is catalyzed by the non-microsomal enzymes. So this is very important to know which the enzyme which is involved in case of the phase 1 and phase 2 reaction. So we say microsomal enzyme can be induced, while the non-microsomal enzyme there is no induction or inhibition. So microsomal enzyme can be inducted or it can be inhibited. So starting with the microsomal enzyme inhibition. So how it can happen. So one drug, it has a tendency to compete in the active site with another drug on the same enzymes. Because they use the same active site, so one drug, it can inhibit the metabolism of another drug. But it can happen that one of the drug has a tendency, it is the substrate of one of the isoenzyme, but it can be the inhibitor of another isoenzyme. The good example here is the quinidine. Quinidine, it is the substrate, has to be metabolized by the CYP3A4 as a substrate, but this quinidine, has a tendency to inhibit the CYP2D6 enzyme as the cytochrome enzymes. So it is very important to understand this one. But for the case of the drug induction, here you can see this drug A, it has to enter into the liver and metabolized by microsomal enzyme, which is represented by this purple dot. So once it reaches, if it will be taken, this drug A is taken along with the substance B or the drug B. This drug B, it will have a tendency to inhibit this enzyme so that the drug A, it will not be metabolized. So by inhibiting this, it can lead to the increase the plasma concentration, which can precipitate to the toxicity. So you as a doctor, as a pharmacist, or as any medical health care, it is very important to know that whether this two drug has to be taken at the same time or not, because of this kind of the drug interaction. So it is very, very important to understand this. So the consequences, I've said that for the case of the enzyme inhibition, this it can precipitate to the toxicity, because one drug, it will not be metabolized and it will increase the plasma concentration. As you know that if it will not be metabolized, it means it will stay in the body because it still is lipophilic. It will not be excreted. This can lead to the toxicity. So that is all about the microsomal enzyme in case of inhibition. Here, what is showing is all about the substance which can be metabolized by a particular cytochromal enzyme. For example, here it is CYP3A4 enzymes, which metabolize more than about 55% of the drug. So here there is a special abbreviation that you can use to memorize how to memorize this substrate which is metabolized, is called CT scan. So CT scan, C stands for the cyclosporine and calcium channel blocker. T, this for tacrolimus. S is statin, and the C stands for 3 drug, which is means the CAT means cat. C means cisapride, A astemizole, and T this tefenadine. But A stands for amiodarone, and N, this is for the nerve-those protease inhibitor as anti-HIV. So this is the substrate that, the example of the substrate that can be metabolized by this enzyme. So there is a special substance which is responsible to inhibit this drug. So we are going to, as we have seen here, there is a special mnemonics that you can use to memorize those inhibitor of the CYP3A4, which is called, in this case, there is a special which is called vitamin K cannot cause enzyme inhibition. So here there is valproate. V means valproate, like ketoconazole, another substance, the fluconazole, dry fruit juice. So I will show you in a very manner which are the mnemonics that you can use to memorize all this drug in a very simple ways. So that is the substrate that is I said that you can use this abbreviation called CT scan, and you have to know each letter what the drug has stand for. So it is very, very important to use these mnemonics that you will understand easily. So because we are talking about the enzyme inhibition, that inhibiting those microsomal enzymes, the mnemonics for those substances that act as enzyme inhibitors, vitamin K cannot cause enzyme inhibition. Vitamin K, the word vitamin stands for the valproate. This is the drug that used in the seizure. K means ketoconazole and other azole and fungal. And cannot means this is metidine, cause ciprofloxacin. Enzyme means erythromycin, and inhibition stands for the isoniazide. So that is all about the induction. It is all about the inhibition. Now you can see the induction, meaning that induction is the substance that has a tendency to increase the production of the microsomal enzymes or increase the catalyzation of the drug by activating the microsomal enzymes. So this we can see here, as usual, drug A has to be metabolized by the enzyme which is present into the endoplasmic reticulum with the hepatocyte, but by taking the substance A, it will have to amplify the action of the enzymes, and then the metabolism, it will be fast. As you can see here, there is amplification. This, it can result to increase the metabolism of the drug to 2 to 4-fold times, you see, and this it will reach to the maximum peak for about 4 to 14 days of the after increasing the process of the inducing this cytochrome enzyme for the metabolism of drug A. So that is all. And the consequence after taking the drug that has a tendency to cause enzyme induction is to increase the intensity and the duration of action of the drug. So by doing so, this it can lead to the therapeutic failure of the drug, because the drug it will be immediately excreted without inducing the pharmacological effect. But also it can lead to the drug tolerance. As you know, there is some of the drug has a tendency to cause the autoinduction. This drug has a tendency to cause the tolerance, and it includes the rifampicin and the carbamazepine drugs. So these are the same slide that indicate the subset, the inhibitor, and the inducer of the microsomal enzymes. And the subset, I said, you can use the CT scan to memorize, and you can use this called the GPRS cell phone, this to memorize those mnemonics, to memorize those drugs which has a tendency to cause the enzyme induction. G, which means glycofulvin, phintoin, rifampicin, smoking. Cell stand for the carbamazepine, which has a tendency to cause the autoinduction. The phone, which means the phenobarbital. So these are the mnemonics that you can use easily to memorize those drugs that cause the enzyme induction. So far, we have seen those the microsomal enzyme and non-microsomal enzymes. So as we have seen, this process of the biotransformation that involves the chemical alteration of the drug from the lipophilic into the hydrophilic, this in most cases, almost each of the reaction, it involves the utilization of the enzyme, whether it is microsomal enzyme or a non-microsomal enzyme. But it happened that there is some of the drug has a tendency to undergo the rearrangement or molecular rearrangement when it is in the body, and form the drug which is the polar drug which can be excreted. So this reaction, it does not involve any enzymes. This is called the Hoffman elimination reaction. So it involves the inactivation or spontaneous molecular rearrangement without energy, and it cannot use any other agent or energy. The good example that can undergo the Hoffman elimination, this molecular rearrangement, is called atracuria. This is the skeletal muscle relaxant substance, has a tendency to undergo this Hoffman elimination reaction. So for this case, there is no enzyme that is taking place, and there is no microsomal, no non-microsomal enzyme. So the drug will be excreted directly without utilizing any other substance or no enzyme that are involved. So the last thing that I want to discuss in the process of the biotransformation, it is the first pass metabolism. This is the metabolism that is taking place during the passage of the drug from the site of absorption into the systemic circulation. Before the drug reach into the systemic circulation, the drug has a tendency to undergo a certain metabolism, and this it make the drug to have the bioavailability of less than 100%, because some of the drug they get degraded. This metabolism it takes place especially into the intestinal wall and into the liver. Means it undergoes the metabolism before it reaches to the systemic circulation. And it is very common, especially for the drug which is taken via the oral route. And some of the drugs, they are considered as the extensive first pass metabolism. So this drug, it is mostly taken through the parenteral route of drug administration or other route apart from taking the drug via the oral route. So if you can see here, if you take the drug through the oral, for example, if the tablet, taking them through the oral medication, it will reach into the stomach, especially into the intestine, where it will get absorbed. So during the process of the absorption, it means that not all drug it will get absorbed and reach to the portal vein. Some of them it will not be absorbed and eliminated through feces. So some percentage it will be reduced. But here it will be taken first into the liver via the portal vein, where it will undergo metabolism. Then it will be taken through the hepatic vein, reach into the systemic. So you can see before the drug reach into the systemic circulation, there is a number of the metabolism that is taking place by the drug. And you know, once the metabolism is taking, it means there is some percentage of the drug is losing. That's why the bioavailability of the drug of the most of the oral administration, this is not 100. Most of them, they are below 100%. So the same fate here, it indicates once the drug reach into the GIT, especially the stomach, then it will reach first into the liver where it will undergo the metabolism. That's why fast pass means it will pass first into the liver before it reach into the systemic circulation. So by doing so, it will reduce the amount of the drug that will reach into the systemic circulation. That can affect now the bioavailability of the drug, which can have impact on the amount of the drug that reach into the systemic circulation. So you can have a doubt, like you as a doctor, you as a pharmacist, what are the important to understand this fast-pass metabolism? Because if you know that this drug has a tendency to undergo the fast-pass metabolism, you have to adjust the dose. Because if you take a normal dose, it means large quantity of the drug will just lose and get excreted before it reaches into the systemic circulation, and it will be eliminated without causing any pharmacological effect. And this fast-pass metabolism, it is varying. It is not the same between one individual to another. So it is important also to keep in the mind that the fast-pass metabolism is varying among the individuals, and depending on the enzymes, and especially if the patient has the issue of the liver disease, the bioavailability of the drug, it will be very high because the drug will not be metabolized in the liver. And this is very important to understand. And what are the drugs that you should know that these are the drugs that has a tendency to undergo extensive first-pass metabolism. This you can memorize them by using a special mnemonics, which is the nitrate have larger pre-systemic metabolism. What is nitrate? It stands for the drug which itself, which belongs to the nitrate group. So this including the nitroglycerin group. So those drugs belong to the nitrate group that has a tendency to undergo the process of the extensive first-pass metabolism, including those drugs that we use especially in the angina. Have it stand for hydrocortisone, which is the steroid. Large, it stand for the lignocaine, which is the local anesthetic. Pre means propranolol, which is the beta-adrenergic non-selective blocker. Systemic salbutamol, and the metabolism stand for the morphine. So most of the drug which undergo the extensive first-pass metabolism is that drug which is when it is taken through the oral route in comparison when it is taken through the parenteral route. And as I said, there is individual variation in the case of the fast-pass metabolism among the individuals. And the oral bioavailability, it can be increased, especially for those patients with the liver disease. So if you want to increase the oral bioavailability of the drug, it can be increased by taking another substance which can inhibit which can compete in the first-pass metabolism, so that another substance that will fail to compete, it will not be metabolized in the liver, and it will increase the plasma concentration. So that is all about the process of the metabolism, and thank you for watching. Welcome to the next session that will be conducted very soon. Don't forget to like, to subscribe, and comment, so that you will get the update for the new lecture that I'm going to upload. Thank you very much.